It is said that beauty is in the eye of the beholder.
I looked in the mirror and I just saw someone really disgusting, very ugly girl.
But what happens when you look at your own reflection and what you see is an unending source of torment?
I feel gross. Because my chin is so little, I feel like that or something. And I feel really gross and disgusting.
I wake up every day and the first thing on my mind is, how will I look today?
These lives have been rocked by a little-known disease called body dysmorphic disorder, or BDD.
It was just destroying our life over these nose hairs that I couldn't even see, that didn't even seem to exist.
I feel comfortable at night because I figured people can't see me at night.
For a person with BDD, life hangs on a tenuous thread of shame, secrecy, and self-loathing.
Body dysmorphic disorder is not a trivial illness. It can have a lethal outcome if untreated or if inappropriately treated.
I never did understand it, I'm afraid, until after he was dead.
Caught in a desperate struggle for normalcy, BDD sufferers find themselves lost in mirrors, yet unable to accept their reflection.
When you're having a relationship with a body part, it's very difficult to have a relationship with somebody else.
Find out everything you need to know to help yourself or a loved one battle this strange disease in I Feel So Ugly, Body Dysmorphic Disorder. About our looks.
In some respects, we're all running around dissatisfied with our appearance, and it's just part of the common condition of being in America.
But what happens when the ordinary daily check in the mirror turns into an uncontrollable compulsion?
People with body dysmorphic disorder worry that there's something very wrong with how they look, when in fact they look fine.
And this imagined defect in appearance is all-consuming, literally overshadowing everything else in the sufferer's life.
I can't be myself with this face that I have. That's what it feels like.
I looked in the mirror and I just saw someone really disgusting, very ugly girl.
It's a fairly common disorder, but most of these individuals don't talk about it. They're embarrassed, they're ashamed, they're afraid that people will think they're vain.
For people with BDD, the world becomes an unending source of reflection, with judgment in every face.
If people see me smiling that I don't know, or people in public see me smiling, that will make me very, very uncomfortable.
People with BDD tend to think that other people are taking special notice of them, laughing at them, making fun of them.
If I feel anybody looking at me from my profile, I get really freaked out.
In our increasingly visual world, the incidence of BDD is sharply on the rise, affecting nearly 4 million men and women in the United States alone.
The best estimate, I would say, is in the range of 1% to 2% of the population.
The more we measure our bodies against idealized images on TV and the movies and ads on the internet, the more we sort of start to fantasize that our bodies are less than ideal. Is this going to mean an explosion in BDD? It has already, and it probably is going to continue.
The paradox of body dysmorphic disorder that it has very little to do with actual physical appearance. It has to do with body image, which is altogether a different term.
What counts in body image and BDD is your inside perception of yourself.
That's all that goes through your mind, is that you look terrible. There's nothing you can do about it. Everyone thinks you look terrible. There's no way you're going to be able to make friends, have relationships, just cope with life.
If you think your nose is way too big, pretty soon all you think of is being just one giant nose. And you forget about your happy smile or your twinkly eyes.
BDD often takes hold during the most tumultuous time for both the body and the mind, adolescence.
We have found the most common age of onset is about 13. As you know, adolescence is a time of very important ego development. Development of a sense of self and identity and values and relationships and a sense of competence in one's place in the world. And I think that BDD often completely disrupts that. It very much affects their sense of self.
Although 22-year-old Elizabeth Delaney's BDD appeared when she was 15, her mother recalls signs that all was not well very early on.
When she was 2, there was not a pair of socks in the drawer that she would put on. And, you know, everyone would say, well, she's only 2. How can you not put a pair of socks on a 2-year-old?
I didn't like the way my body looked, and I couldn't, no matter really what clothes I put on, I just couldn't be comfortable.
In Elizabeth's last year of high school, an offhand comment from a friend about facial hair triggered an even more compulsive obsession.
A good friend of mine said, Beth, you got sideburns or something. And as soon as he said that, it was just like, oh my God.
An attribute common to BDD sufferers is hypersensitivity to negative comments.
People with BDD are not particularly narcissistic. In fact, most of them don't want to be noticed. They think they're being noticed in a negative kind of way, and they simply want to blend into the crowd.
Trying to blend into the crowd forced Elizabeth into an endless cycle of obsessive behaviors.
Tweezing, shaving, bleaching, electrolysis, waxing, depilatories, you name it. I've tried it out, and they temporarily fix things, but it doesn't help me to cope with the way I feel inside.
Spending more and more time in front of the mirror, attending classes was a struggle.
By college, this was a daily concern of mine, something that was just really stressful to me in my everyday life.
After reading Catherine Phillips' definitive study, The Broken Mirror, the only book published to date on BDD, Elizabeth began to explore photography as a way to alleviate her anxiety.
Photography's kind of helped me to put everything in perspective. When I'm photographing myself, it's just something that I do alone. It's really therapeutic for me. I've always enjoyed photographing, like my dad. I think he's probably been a big influence on me.
I think it's nice that we have that common ground, and maybe that's something we've been able to share in a different way.
Giving a voice to her long-hidden feelings gave Elizabeth the determination to find help.
So I went online to research obsessive-compulsive disorder, and somewhere within that article was a side note about body dysmorphic disorder. I clicked on that link, took me to the description. I read it. It's like, that's exactly how I feel.
BDD was recognized as a subcategory of obsessive-compulsive disorder, or OCD, in 1987.
The core symptom is the obsession about the perceived appearance flow.
Although the eating disorders, anorexia and bulimia, also involve distortion of body image, there are some important differences between them and BDD.
BDD generally involves the face or head, you know, skin, hair, nose, etc., whereas the eating disorders tend to focus on body weight.
Hi, Elizabeth. How are you?
Good, how are you?
Okay, come on in.
Dr. Sabine Wilhelm of Mass General's BDD clinic in Boston treats BDD patients, like Elizabeth Delaney, to help them overcome their obsessions.
Elizabeth spent 8 hours per day thinking about her appearance. She would check the mirror over and over again. She kept asking her mother for reassurance.
BDD sufferers constantly seek reassurance from those around them.
I'm quoted in my high school yearbook as saying, 10 years from now, I'll be still asking what I should wear.
The tragedy is that the feedback that they receive from outside, even if it's very positive and consistent, does not help them.
One thing that has shown promise is a process called cognitive behavioral therapy, or CBT, which in tandem with drug therapy helps patients cope with their anxiety.
Patients learn to identify and challenge their negative cognitions, that is, their negative thoughts. In our clinic, we often recommend that BDD patients do both medication and behavior therapy, especially if a patient has severe BDD. Did you try to resist the thoughts, or could you let them come and go naturally?
Some of the thoughts I try to discount in my mind and just push them aside. Other ones were just kind of silly, superficial things that I could let go, and other ones definitely had more weight to them.
Even if a patient has only a partial response to a medication, even if they're just a little bit less anxious, I think CBT can just help them improve further.
When you think about the last week, were there any situations that made you feel sad or anxious or tense?
Yep, there was a situation when I took a ferry out on the boat where I was very uncomfortable with the wind blowing in my face, my hair.
What was so uncomfortable about that? Why was it uncomfortable for you?
It's just really exposing.
And remember, you start with your hair, and then you walk me all the way down your face to your chin. And it's really important that you use objective terms as you're describing your face.
When we first started doing the mirror exercises, I felt really silly going down describing my face. The more we practiced the exercise, the easier it got. My hair is blonde to my shoulders. My forehead is about... I have to think about how I'm seeing myself instead of immediately picking out my flaws and focusing entirely on them.
The behavioral part of the treatment focuses on helping patients reduce problematic behaviors. When you think about the past week, how much money did you spend on appearance-related products?
A few $100s.
After the cognitive behavioral therapy, I did notice a big difference with Elizabeth. She stopped drawing me into her decisions. And it's not that I minded being consulted. I minded when there was no answer that was going to be correct.
CBT helps patients challenge their negative beliefs and change their way of thinking about their appearance.
As I was stepping from one stone to another, the camera clicked and I got a perfect reflection of myself in the water. It symbolizes just the transitions that I'm going through and just really taking every day, step by step, day by day, little things. Eventually I'll get there.
While Elizabeth can begin her adult life well armed to battle her illness, Jason Fellows is just starting to understand his BDD.
The first thing on my mind is, how will I look today? Will I look any different, any better?
How do parents cope with their children's illness, and what happens when BDD surfaces later in life? While BDD most often emerges in adolescence, it is rarely correctly diagnosed until much later. Now 24, Jason Fellows remembers his youth before BDD struck at the age of 15.
I was happy. I had lots of friends. It didn't cross my mind how I looked or how other people thought I looked.
As is often the case with BDD sufferers, one seemingly commonplace event turned Jason's self-perception upside down.
I held up a hand mirror so I could see my face in profile. And I remember just getting a real shock and thought I looked absolutely awful. And I had a panic attack about that.
Jason's main preoccupation is with his face. He is not working and he is very limited in terms of his social contacts. He's very concerned about different features, facial features, and perceives them as being, as he calls it, hideous.
It's very hard to describe what I see when I look in the mirror. To me, it's off-putting. It's very ugly, very unattractive. My head looks big and abnormally shaped, distorted shape.
Jason's feelings of ugliness have made him a virtual hermit.
I miss waking up in the morning and looking forward to what I'm going to do that day. I miss just having a life worth living, really.
Jason's parents, Penny and Ken Fellows, have traveled from Tasmania, Australia to Los Angeles, desperately seeking help for their son.
They're not experienced with it in Australia. And so we were really anxious for him to meet with someone who had a lot of experience in BDD.
We think about things we were doing at Jason's age or younger, you know,
and
traveling,
what he's missing out on.
what he's missing out on. And his brother is quite outgoing. He goes trekking around the world and things like that Jason would really love to do, but just
hasn't been able to.
And it's very sad.
Penny and Ken struggled with Jason's illness for years without even knowing what it was.
But it's a very difficult disorder to understand when you look at your child who looks perfectly normal and they think they're the ugliest thing that's ever walked the face of the earth. And he went through different stages of camouflaging, where he grew his hair long and tried to keep it very much over his face.
You're always having to perform rituals of like checking yourself in the mirror, grooming, checking any reflective surface, really.
Patients who have it for some time frequently become so depressed that we need to attend to the depression first before we address body dysmorphic disorder.
We discovered it wasn't that easy because it's a combination of medication and cognitive behavior therapy. There's no magic pill as yet you can take and your BDD is gone.
After only a few weeks with Dr. Maidenberg's help, Jason's perception is starting to shift.
I don't look as bad as I think I do. People who talk to me say that I have a nice face.
If he continues being motivated as he is now and continue putting a lot of work into it as he does now, he's likely to become much improved.
But Jason's parents will never be able to forget the child they knew before BDD took over their lives.
I see a big, gorgeous, handsome man who is wasting himself by hiding away. We just remember him as he was and all the talents that he has. I've gone through times have been really strong and other times I've had to hide away for a day because I couldn't stop crying. I wouldn't say I've obtained any new insights other than being aware of the miracle that all of us do as well as we do when it just takes a few little neurons in your brain to fire wrong and you end up with something like BDD that absolutely messes up your whole life.
While it may take Jason and his family years to undo the damage of BDD, for others, BDD strikes later, halting life midstream.
When I got married in 1985, my wife wanted children, and I didn't want children, and we fought back and forth on that.
46-year-old Doug Terrell of Rhode Island was in his mid-30s when stress triggered his BDD, an obsession with imagined acne.
She kept hopping and hopping on it, so I guess the stress started showing up on my face, you know, and I never had that bad complexion growing up and everything, but for some reason I noticed something and said, gee, this wasn't here before.
Doug's obsession with his skin quickly spiraled into full-blown BDD.
In maybe 25% of cases, it begins pretty suddenly.
I knew there was something wrong with me, but my wife didn't know whether or not to pat me on the back or kick me in the ass, you know. 18 months before I was diagnosed with BDD were the worst 18 months of my life. I've never been to hell, but I sure felt that I was living in it.
Doug's experience with BDD is in some ways typical and in some ways a little bit unusual. Typical in the sense that he has all the classic symptoms. Skin concerns are the most common concerns of people with BDD. He's a little bit unusual in that its onset was later in life.
Doug began treatment with Dr. Phillips in 1992 at the Butler Hospital in Providence, Rhode Island.
He was treated with a relatively high dose of Prozac, excellent treatment.
So how are you doing with the medication?
Well, you told me to gradually increase it. Now I'm at the 80 milligrams. I've been going for 2 weeks.
And no problems with side effects?
No.
Although Doug has benefited from drug therapy, he draws the line at cognitive behavioral therapy.
You mean facing your worst fears? Forget it. No way, Jose.
Instead, he has managed to find distractions to curb his obsessive thoughts.
I do my running. That's a stress release. I go out and run and it just kind of relaxes me.
But he still finds it difficult to look in a mirror and has learned to shave in the dark.
This may sound strange, but I just don't want to remember what I look like.
Divorced since 1990, Doug now dates online, but does not see marriage or children in his future.
I'm not going to spread my mixed up genes to my offsprings and have them go through that.
One of the reasons Doug has really done quite well with his BDD is that He received the correct diagnosis relatively early on.
Doug was one of the lucky few. Being correctly diagnosed with this rare disease can be very difficult.
It takes about 17 years between the onset of symptoms and when these people finally get appropriate treatment.
Because BDD patients absolutely believe that something is physically wrong with them, they often look for help in all the wrong places.
We found that 12% of the patients who went to see a dermatologist screened positive for BDD.
For Chris Saville, the diagnosis her son needed came too late.
He was saying to me, "You don't understand, so I'm going to kill myself. I've had enough. There's no hope." He said he felt like an alien on the planet.
What happens when BDD turns deadly? And how do parents cope when they're the ones fighting this terrible illness? For people suffering from BDD, it's like speaking a language no one can understand. 24-year-old Glenn Saville knew only too well what that isolation felt like.
Self-consciousness has taken me completely over. I couldn't even hold my head up. In fact, I can't think of any friends I have got, which to me just reinforces the feeling that I am ugly. After a while, I began to question my very existence. When I'm amongst people, I clam up and find it extremely difficult to socialise. But the doctors had no answer.
For 8 years, London native Chris Saville tried to convince her son that his forehead looked normal.
There was absolutely no convincing him at all. What he saw in the mirror was a monster, and what we saw was a very nice-looking young man. So it was so bizarre. Glenn would always say that his brother was very good-looking and he was very ugly. I got so exasperated by all this that I sat them together, side by side, and I took 2 or 3 photographs. When the photographs were developed, he said, "There you are, Mum." Although the boys looked almost identical, he thought he had this ugly face, but his brother was fine. I'd look at him and say, "Well, where is it ugly?" And he just said, "The forehead is too big." And it wasn't. That was the difficult part. And the chin sticks out. Well, it didn't. So it was very difficult to understand.
Chris Saville struggled to find help for her son's mysterious illness.
I had no idea how to help him, and I just did what I could. We visited homeopaths, acupuncturists.
In 1991, Glenn was treated as psychotic.
Glenn was given a very strong drug initially after the visit to the psychiatric hospital. A few weeks into the treatment, we had to rush back to the hospital at midnight because Glenn was having spasms.
Years of struggling with an unknown enemy ended when Glenn Saville found his way out.
On Monday, 28th October 1991, I got up ready to start my new job and went in to say hi to Glenn, and he was very upset, and I got quite cross with him, and I said, "Look, I've written you a note of things to do to keep you busy during the day, and on this note, which I still have, at the bottom I put, don't do anything silly."
Chris went to work and returned that evening to find a dark house.
I got through to the back of the house and I could see him sprawled on the floor.
Glenn had hung himself.
Turned his face over and there was this deep groove in his neck. And he was dead. But he looked so peaceful, so pleased by that. And the only crumb of comfort was that, thank God, he's out of all his misery. And I never did understand it, I'm afraid, until after he was dead.
1 month after Glenn's suicide, Chris got the call she had been waiting for so many years.
A friend of mine called me and said, "There's an article in the Daily Mail, one of our national dailies, and it sounds like Glenn." And all the hairs at the back of my neck stood up.
An article in Dr. Catherine Phillips' book, The Broken Mirror, explained Glenn's mysterious illness.
Well, of course, I felt very guilty. I thought to myself, why didn't I get a second opinion? You know, all sorts of things that I hadn't done. But then I began to rationalise, and I thought, look, I did go for professional help, and I didn't get it. I didn't get what Glenn needed.
86% of BDD sufferers consider suicide, and 30% will attempt it.
And unfortunately, suicide is not an infrequent endpoint in patients who have this terrible illness.
Among my own patients, about 25%, 25 to 30% have attempted suicide.
Glenn would say to me, "Mum, you had me. You should help me get out of this world."
While it is hard for parents to cope with a child's BDD, it is equally tough being a parent suffering from the disease.
I haven't been able to be with my son emotionally, and I really fight to stay with him. I have to fight the BDD just to have a relationship with him, and he senses this at all times.
For Tom and Patrice Kuschel of Painesville, Minnesota, the road to wellness has been long and hard.
I've been in therapy for years, but I've really never resolved anything.
I can show you the list of all the different approaches we've taken, from the U of M hospitals to all the alternative stuff, homeopathy for 2.5 years, acupuncture and herbal things, and nutrition, exercise.
Patrice has suffered with mental illness for most of her adult life, and while she was only recently diagnosed with BDD, it appears to have been present when she was a teenager.
When I was 19, I had it with my mouth. And it got to where I couldn't speak anymore. I'd have to put my hair in front of my mouth.
Patrice's BDD re-emerged years later, this time with a new focus.
I looked in the mirror for 32 years and never noticed my nose hairs. And all of a sudden, it's like I go in the mirror and they just jump out at me like, look at this.
For me, it was just absurd that it was just destroying our life over these nose hairs that I couldn't even see.
And I don't know what a picture perfect of nose hairs are, but my biggest fear is that one would grow out, that you could actually see and you'd have to clip. It's like I really feel that would be the end of all end all. I couldn't handle that.
In the 2 years since her BDD resurfaced, the family's life has changed dramatically.
I came home one day. She was supposed to have left with Jacob at 8 o'clock in the morning. I came home at 11, and she was in the bathroom in front of the mirror. She was crying. She said, I can't leave. I can't get out of here.
My son Jacob would be watching me, and he'd even make comments like, Mom, what are you doing in the mirror, looking at your teeth and stuff? And so that just really broke my heart.
I used to be very active in the outdoors, backpacking, hunting, fishing, canoeing, camping, kayaking, a lot of things that I just haven't been able to do anymore.
It wrecks me all day, and I feel very suicidal. I feel I can't cope. I lose connection with my son. I've always wanted to be healthy for him. I wouldn't have had him if I'd have known any iota that I was going to be sick again.
I think that she understands, very well how devastating it is to a young child to have a mentally ill mother.
Determined to get help, Tom and Patrice came across Dr. Catherine Phillips' book, The Broken Mirror.
The Broken Mirror to me was very depressing because it didn't offer a lot of hope.
It approached BDD with the premise that it's an incurable lifelong condition that could only be tempered with drugs and cognitive behavioral therapy. And we just weren't willing to accept that. We're really approaching this as something that we're going to find the roots of and rid ourselves of.
But Patrice does not believe in drug therapy and is instead committed to a course of traditional psychotherapy to help her cope.
The reason why I don't like to take medication is because I feel that I won't get to the real issues of what's going on.
But the psychotherapy failed to uncover the roots of her BDD, and Patrice became so depressed she stopped eating and drinking for over a week, finally ending up in the hospital, suffering from malnourishment.
Once she ended up in the hospital, that was pretty traumatic for us, especially with me back home here with Jacob, who had, at that point had just begun to fall apart.
It was just getting to the point where I was getting more stuck in the mirror, and my son Jacob was watching me more, so I'd rather not have BDD and maybe something else that was probably maybe even life-threatening, but my mind was good. I could at least be with my son and my husband and my family.
The toll BDD has taken on the family, both financially and emotionally, has been devastating.
We don't go out and see friends. We don't really do much. We might go to a movie together, but that's about it. We've had to skip both family Christmases in the last year and just about every family function. The sacrifices that we've had to make in our family are overwhelming. It's unbelievable, really, what it's done to our family.
Scott Granite also knows what it's like to battle BDD as a parent.
I wasn't much of a father. I just couldn't spend time with my daughter. Any time that I spent with her, I was completely distracted by thoughts of my hair. I just got more and more involved with the hair. Began doing all of the routines just much more so. Showering a lot, shampooing a lot, combing my hair a lot.
From the age of 19, Scott has been obsessed about the loss of his hair.
I was taking a shower, washing my hair, and just looked down at my hands while I was shampooing, and I just saw a ton of hair in my hands. And I panicked.
From that moment, more than 25 years ago, Scott has battled BDD.
There were times when I lived with him after that bout he had that I was afraid I was going to wake up to him killing himself.
Just last year, the birth of Scott's daughter brought new stress to his life.
But our daughter came home with a heart monitor, and so there was a lot of stress with that, and my behaviors became out of control. So I remember one day in particular when I was going to work, and I must have stopped at 10 or 12 fast food restaurants, stores, bookstores, going into their bathroom and checking how my hair looked. It was a feeling of being out of control, of knowing that I couldn't stop this.
It was horrible watching him suffering. And he wasn't happy that everybody concurred that he wasn't really losing his hair. He was looking for somebody to tell him something else.
He was really in a bad way, and he had a look about him that I'd never seen before. And he asked me to go into the bathroom and look at his hair for him, and asked me to tell him what I saw, and did I see what he was seeing. And that frightened me. I thought, I don't understand what he's seeing.
I remember laying in bed and taking the medication out of the pill bottle and putting the pills on my chest and saying to myself, this is probably all I need to do to end it right now.
Fearful that he would do something to harm himself, Scott left his wife and newborn daughter and checked himself into the hospital, where he was treated with antidepressants.
I would look to my future and just see really a lot of darkness. I look back on that to this day as a very dark moment, but it was probably one of the best things I ever did for myself, because it kept me alive.
I told him how much his family loves him and how much his daughter needs him, and that it would be horrible if he were to leave us.
One of the things about this problem is that I live with my hair. That's one of the reasons why having a relationship is so difficult. You know, when you're having a relationship with a body part, it's very difficult to have a relationship with somebody else.
Scott has survived a difficult time, but he's aware that with BDD, things can change at any moment.
It's a frightening prospect to think about having another episode, a very bad episode of this. But I try not to think too far ahead.
For parents struggling with BDD, the fear not only becomes how their illness is hurting their children, but if their children will one day inherit the disease.
There's a biological predisposition. I mean, BDD does seem to run in families. And so there's probably a predisposition to obsess and to worry and to over-focus on minor things.
And I keep an eye on them to see if they have symptoms like I did as a child, and if they do, to get help for them earlier.
How does BDD affect the next generation? And what happens when BDD meets plastic surgery? While body dysmorphic disorder is a fairly new term, BDD was originally identified in the late 1880s and named Imagined Ugliness Syndrome.
Body dysmorphic disorder begins as a psychiatric category in the 1880s and 1890s, at exactly the moment when modern aesthetic surgery begins.
In 1886, Italian doctor Enrique Morselli coined the term dysmorphophobia, from the Greek dysmorph, meaning misshapen.
Morselli says this is a psychiatric problem. The surgeons say, no, it is a surgical problem.
Surgical problem or not, BDD patients are usually classified as either delusional or non-delusional.
About half of these patients with body dysmorphic disorder are 100% certain that the defect really exists. They have delusional conviction or very poor insight.
In an effort to find out what causes this delusional perception, Dr. Eric Hollander uses scans of the brain to study how the neurochemistry of BDD sufferers differs from non-sufferers.
In our patients with body dysmorphic disorder, there's actually decreased metabolic activity in the orbitofrontal regions. So this suggests that it's associated with the very poor insight or the delusional conviction that you see in these patients These orange areas here are areas where there's increased metabolic activity in the limbic system, in particular the anterior cingulate region. When it's activated, you get this terrible sense of distress in the pit of your stomach and this exaggerated feeling that something doesn't look right. The patients with body dysmorphic disorder have the best response to the serotonin reuptake inhibitors. It does suggest that body dysmorphic disorder is a brain-based illness. It's not a psychologically driven illness. Serotonin is a chemical messenger or neurotransmitter in the brain that's involved in many different processes. And we can successfully treat body dysmorphic disorder symptoms by using serotonin reuptake blockers.
Serotonin reuptake inhibitors like Prozac, Zoloft, and Luvox have become household names since they hit the marketplace in the late 1980s.
A woman I treated with Prozac who was convinced she looked like a gorilla. She thought she had a huge hair mask on her face. Came into my office one day and she said, I was treating her with Prozac, she said, the hair's gone. We went down on the medication, all the hair came back.
The Prozac has helped, give me more confidence.
You've got mail.
That confidence is a welcome change for BDD patients who often experience social phobia as well.
BDD and social phobia often occurred together. And in the patients who had both, the onset of the social phobia always preceded the onset of the BDD.
25-year-old mom Michelle Lane of South Carolina has suffered from social phobia and BDD since childhood.
When I was around 11 years old, I was looking at myself in the mirror and I saw my small chin. And ever since then, I felt real insecure about my chin.
Some doctors have theorized that BDD may be an inherited trait, and Michelle's case seems to support that theory.
Michelle has some aunts in another state that they're a lot like her. I think it was inherited.
I was always in my room by myself or crying or something. I never had much of a social life.
She wanted to hang around with me and whoever I might be with rather than play with the other kids.
They used to call me Duck and sing songs about ducky looking and made me cry, and I just felt real ugly.
Both Michelle and Chad pay close attention to the behavior of their sons.
And I keep an eye on them to see if they have symptoms like I did as a child, and if they do, to get help for them earlier. My youngest son I'm a little worried about, and I think he's very jealous because I can't hold another baby without him wanting me to hold him, and I used to be real jealous of other kids.
Michelle's struggle with BDD has taken a back seat to raising her children.
Being a mom with BDD has helped me through it because I have to put my kids first and focus on their needs before mine.
But the disease is always there, no matter how hard Michelle tries to bury it.
When I watch TV like Victoria's Secret commercials, makeup commercials, I feel really intimidated because they're so womany looking and I feel so blah. I want to go hide somewhere.
Comparing themselves to unrealistic ideals of beauty has sent many BDD sufferers to seek plastic surgery.
The temptation to fix themselves becomes so strong that it's very difficult to resist.
We've treated patients who have had up to 23 operations.
What happens when body dysmorphic disorder needs plastic surgery? How can a perceived flaw ever be fixed?
Let us say that you're unhappy with the size of your breasts. Will you go to your psychiatrist and get a pill which will make you happy with the size of your breasts, or do you go and have a breast implant? That's the question for the future.
1/4 of all BDD sufferers will seek plastic surgery.
I would say that most patients that I saw that have body dysmorphic disorder either had or considered cosmetic surgery.
It is estimated that 2 to 7% of all plastic surgery patients have BDD.
I always dated to the 1840s in the development of photography.
The first cases of BDD were recognized some 40 years after the advent of photography.
The first photograph was an extraordinary experience. Suddenly people saw the way they really looked.
Not only could people see themselves, they could see others and compare.
I guess seeing people, beautiful models or movie stars, it makes you feel, or makes me feel a little bit of resentment.
For BDD patients, surgery often becomes another step in an endless cycle of unhappiness.
But most patients with body dysmorphic disorder don't have a good response to the surgery. In fact, they feel that they've been damaged as a result of the surgery.
But some doctors disagree.
Although surgery is
very dangerous as a first step in BDD. Sometimes it's the very thing that jumpstarts that living in the physical.
The literature shows that some patients who we would diagnose as BDD do quite well psychologically after cosmetic surgery. And the fact is that most people who have cosmetic surgery report higher self-esteem and greater sense of well-being.
But patients who find help in neither surgery nor psychiatry often try to fix themselves, often with devastating results.
I know of a patient who was picking at a pimple on her neck with a tweezer and picking, and picked so deeply she actually exposed her carotid artery.
I'd come home and find her in the bathroom just pulling at her nose so she could really look in there, and her nose would be all raw and red, and she'd been in there for hours.
Some patients are desperate enough to perform do-it-yourself surgeries.
One man I heard about actually who took some kind of a knife or something and cut open his nose, tried to remove his nose cartilage and replace it with chicken cartilage in the shape that he wanted it to be in. Or a patient who did his own facelift with a staple gun.
Will there ever be a cure for BDD? While BDD is a complex and difficult illness to comprehend, Dr. Phillips believes the key to a cure lies in early detection.
Realize that BDD does occur in children and adolescents. Don't ignore any appearance-related concerns that your kids have. Look for the clues to BDD.
Make sure that you give a lot of positive messages about competence and worthiness in other areas than just physical appearance.
New studies may hold the promise of better treatments to come.
I'm currently doing some research where we really try to track what happens when patients look in the mirror. We track their eye movements in order to better understand whether patients indeed selectively attend to their defect.
Technological advances in understanding brain chemistry may also lead to new treatment options.
The future really involves a better understanding of the circuitry. There's something called transcranial magnetic stimulation, where you take a powerful magnet, put it right over the right orbital frontal cortex, pulse that region of the brain with powerful magnetic fields, which actually can decrease the electrical activity in the underlying brain regions.
In the coming years, we will have a better grasp of the success rates for current therapies, letting doctors know what works and why.
I'm very hopeful that with cognitive behavior therapy, people can enjoy a very rapid change in their symptoms of body dysmorphic disorder.
But until then, BDD sufferers must live in the present, coping with their illness day by day and finding hope in simple things.
It'll make you happier, making someone else happy, and just focus on them and not yourself. Because kids usually don't care what you look like anyway. They love you no matter what.
I think when Jacob sees me, he sees a mom who really loves him, who's done her very best, because from the very beginning, this has all been for Jacob.
In terms of a cure, nobody talks about that in terms of BDD. People talk about managing it, and that's what I look for myself.
I think about it every day, and I probably will for the rest of my life. It's something that's always going to be there.
I guess I go to bed at night most times thinking that tomorrow will be better now.
I think most people with BDD, even with treatment, tend to have some remaining symptoms. There is maybe 20% will go into full remission. For most people, it's a matter of managing it and trying to keep the symptoms under control. It's sort of a lifelong struggle to live with this problem.
It's possible to bring people to almost normal functioning in their life. The big question is always what happens 5-10 years later. And since we only now start to look into it, it's very difficult to answer the question.
We have really basically one option, and that's to get Mom healthy. And that's what we're going to do, and I don't know how long it's going to take.
Patrice has been hospitalized repeatedly for body dysmorphic disorder. Like many other BDD sufferers, her struggle continues.
When fire burns up a crime scene, investigators must rely on special forensic tools to uncover the clues. See how it's done up next on The New Detectives. And check out more sophisticated crime-solving tricks on The New Detectives fan site at discovery.com.